Welcome to the University of Louisville. And I'm Sonia Harden. I'm the Dean at the School of Nursing. And I'm thrilled to see all of you here tonight for the white coat ceremony. And I thought I would just start out for a minute and share with you a little bit of history about the white coat. I will tell you that it means a lot to me to be here tonight because I too am a nurse practitioner and predominantly have worked in neurology for many years. And I know that the career that you're embarking on is going to be fabulous. Now, the white coat, I see everybody's brought one tonight. I just wanted you to know that white coats were preferred because it symbolized cleanliness, purity, and righteousness. White did not fade when they were washed on very high temperatures, and that was considered important to kill the germs. And I think today we know that is still important, right? So white coats were initially worn to prevent the provider and the patient from contaminating each other. So a provider would wear that white coat to protect themselves. The white coat pretty much started around 1920, and it historically has been associated with physicians. However, as nurses, dentists, physical therapists, occupational therapists, all disciplines that have started gaining a doctoral degree, more and more are holding white coat ceremonies. So the white coat ceremony for each of you is a rite of passage that symbolizes that you are about to enter the world of advanced practice nursing and will be delivering a high level of care. So you'll be having a high level of accountability with prescribing and diagnosing your patients. Again, I'd like to welcome all of you to our white coat ceremony tonight, and I'd like to introduce Dr. Sarah Robertson, who is the director of the DNP program. So please give her a round of applause.
Welcome, everybody. It's an exciting time. One step closer. Okay, so once again, in 2020, nursing was ranked the #1 ethical and most trusted profession in the annual Gallup poll. Personally, being a nurse, I don't find this surprising as I hear and see examples of this all the time. This year especially, nurses have taken on amazing responsibilities to care for patients with coronavirus. Not only are nurses performing their standard duties of caring for patients' IV access, administering medications, and monitoring essential functions like respiratory status, nurses are the key to patients' contact with the outside world. The trust that families place in nurses is extraordinary, and as a profession, we rise to the occasion. This trust extends beyond the hospital setting. I was recently at a conference, and the Dean of New York University School of Nursing was recounting events that took place days after Hurricane Sandy flooded New York City. Nursing students were recruited to canvass the apartment buildings that were partially flooded and had no electricity. She recounted on how over and over again they would enter the stairwell of a towering building that was completely dark, except their own flashlights. They would yell, "Nurses here! Does anybody need help?" And time after time, doors opened, candlelight spilling out and illuminating the space. Each time, the amazement never wore off. When people heard that it was nurses, the doors flew open and they were welcomed inside. I've personally been a recipient of this trust, as I'm sure you have too. I'm sure many of you have been at a school function, ballpark, or even a grocery store when someone asked for a nurse. Just by the fact that you said you were a nurse, that stranger trusted your advice. Today is the day we celebrate taking that trust to the next level. As a nurse, even though a lot of the work was done by you, generally there was someone else calling the shots. Someone else prescribing, someone else ordering the next best test, and someone else diagnosing. Soon, that is going to be you. Sure, you will collaborate with your experienced NP and MD or specialist colleagues, but in the end, you will have the final say over your patient. You will be prescribing ordering tests, and diagnosing the patients. And the patient is going to trust you. Today is the day that you start to earn that new level of trust. You earn that trust by going to your clinicals excited and ready to learn. You earn it during clinical day by practicing and honing your assessment skills, practicing taking a history of present illness and review of systems, and making sure your questions are guided by that revolving list of differentials in your head. You earn trust by writing down questions or patient scenarios and reviewing your patho, pharm, and specialty class notes so that you can truly understand the problem and the plan of care that was delivered that day. The move from sitting in the classroom to actually seeing patients is exciting and terrifying at the same time. But you are the most prepared class in history. All the specialty tracks have more class time in the DNP curriculum than ever before. This is the first time that FNP and adult primary cares have had a standalone psychiatric nurse practitioner class or psychiatric mental health class and a women's health class. You have learned how to find and implement the latest in evidence-based practice and analyze research for its quality. You are ready. You have to be. Just 5 miles from here, I see a population of patients that speak very little English. Their level of health literacy is moderately low at best. When they come and see me, they haven't been scouring the internet to figure out the latest fad treatment. They are too busy working. When they come and see me, they trust that I have studied hard and that I continue to learn and continuing education. They trust that I care, and they trust that I will do the right thing for them. Some of you will work in a suburban setting. You will be surrounded by your provider colleagues and people that you can consult, might be literally right around the corner. But many nurse practitioners don't choose that route. Many NPs end up providing care to the most vulnerable in this society. You may be the only nurse practitioner providing care in a county or region, and specialists might be more than 100 miles away. You are it. You are the lifeline of the community and the last and only stop for health care. Your patients put their trust in you. They have to. Sometimes there's no one else. So today we celebrate this transition by donning the white coat. The coat symbolizes your new level of responsibility and the knowledge you have gained. And as you go forth, please know that you are ready. Work hard. Don't slight yourself. It is a gift to be able to spend a year and learn without pressure in the clinical setting. Each day can seem long, but the year will go fast. So dig in and double down, because in one short year, we will have the privilege of gathering again for another special milestone, graduation. Thank you. I would like to invite to the podium Dr. Mary DeLetter for the reading of the names for the white coats.
Good evening. It's so nice to see all of you here tonight. I'm going to start with a student who is pursuing a dual certification in adult gerontology and acute care and primary care nurse practitioner tracks. I do want to let you know that you have a new acute care nurse practitioner track coordinator. That is Dr. Shannon Shoemaker. She was unable to be here this evening, so Dr. Sarah Robertson will don your white coats. So our first student, Luke Ressler. The next group of students are in the adult gerontology acute care nurse practitioner track. Megan Bramlett. Erica Keithley. I may have misread the check mark. Gulam Mughal. Chrissy Sellinger. Our next group of students are pursuing the family nurse practitioner track. The first two students, which will be given their white coat by Dr. Deidre Hayden, are pursuing both family nurse practitioner and adult gerontology primary care. Andrew Oshbacher. Nina Johnson. She likes the stage, I think. Pursuing the family nurse practitioner track, Brittany Cornell. Jennifer Fox. Lisa Gaines. Lily Zhang. Aminata Guy. And now Dr. Lynette Galloway will be providing white coats to the rest of the family nurse practitioner students, starting with Kelsey Houchins. Griffin Knepp. Whitney Augie. Molly Rechtenwald. Madeline Sass. Emily Neal. There will be no bad pictures from this ceremony. Lauren Top. Okay, congratulations to the family nurse practitioner students. Our next student will be a neonatal nurse practitioner student, Sheila Kingsley, and she will receive her white coat from Dr. Leanne Baker. And finally, we have 3 psychiatric mental health nurse practitioner students. Our track coordinator, Dr. Mary Beth Cody, could not be here this evening, so you will receive your white coats from Dr. Sarah Robertson. Elizabeth Buchanan, Phoebe Gerges, and Heather Scott. And probably one more round of applause for all of you. Congratulations. At this time, our Dean, Sonia Harden, will provide some closing remarks.
I want to again welcome all the people that came a little bit later than when we started, and let you know that Dr. Sarah Robertson works tirelessly to make sure you guys have the best experience possible while you're here. Be sure to reach out to her if there's anything at all that you need, and we are thrilled that you've chosen the University of Louisville